West Little Rock, to no surprise, is a growing part of our community. So over the last several years, we've worked with inside and outside partners to look at how best to develop medical services in that part of our community. With some outside help from a land development specialist, we picked a site close to Rawling Road and Chenal Parkway, kind of the epicenter of West Little Rock, to develop medical care services. We also partnered with Deltic Timber to find an appropriate spot as part of their Chenal development in which we could offer really a healthcare village, a destination for health and wellness services.
St. Vincent's has been an integral part of providing life-sustaining support to our citizens since 1888, over 123 years now. And as the city has grown, so is St. Vincent's now growing, and I think that's very important.
St. Vincent West is a multi-year, multi-million-dollar investment in Little Rock. The first phase will really kick off with primary care or essential services for that part of the community. So we'll be offering family medicine.
Family practice is a medical specialty devoted to the health care of patients of all ages, with particular attention to preventive medicine.
Urgent care for those acute needs after hours.
An urgent care facility can care for those non-life and limb threatening urgent problems and deal with them in a timely fashion.
And then our Longevity Center for the growing senior population in West Little Rock.
The staff at the Longevity Center at St. Vincent's provides the highest quality health care by focusing on good quality of life and meeting overall expectations in health care.
The second phase will really focus more on specialty care with ambulatory surgery, diagnostic imaging, and specialty physician practices. And I think over the years to come, you'll see many more surprising things at St. Vincent West that'll help your health and wellness. The Sisters of Charity of Nazareth had great foresight in 1954 when building the infirmary campus and acquiring more than 40 acres. So hopefully they've given us the same insight in purchasing 37 acres in West Little Rock. St. Vincent's been around for 123 years, so our planning horizons aren't this next quarter or this next year or the next 5 years. We're really thinking about the healthcare needs of West Little Rock over the next 50 years. So that's why when we talk about St. Vincent West, what's happening today and then what happens 5 to 7 to 10 years from now are very different. And we're really planning for a long-term future in that part of our community.
You know, every time we're trying to recruit new companies to the area or work with existing companies in expanding here, one of the things that differentiates us from our competition is the quality of health care here. Not only that quality, but the cost, the availability. And this expansion obviously gives us even a further leg up on our competition as we're out trying to bring more jobs, more people to live and work in Little Rock.
The mission of St. Vincent is to nurture the healing ministry of Jesus Christ. Our mission statement doesn't talk about running hospitals or physician practices or running a business. Although those things are important, we have a higher calling here, and it's really to serve the needs of our community in a very holistic way. So I think the expectation everybody can have of St. Vincent West is that we're going to care for you, body, mind, and spirit, and we're going to do what we can to improve your wellness and well-being.
The legacy of St. Vincent
is caring for our community.
As Central Arkansas's first hospital,
we've served generations of families.
It's something I learned from my sisters.
My father practiced medicine here.
And so does my brother.
And we're all proud to have followed our father here too.
It's a legacy of quality and inspiration.
Dedicated to serving the needs of our community for more than 120 years, St. Vincent, inspired.
In 2007, we opened a family practice clinic on Rawling Road in West Little Rock. And then in 2010, we opened the clinic at Walmart in Chenal. Both of those have been wildly successful. So we see a tremendous demand for primary care and urgent and emergency care and care for seniors in the West Little Rock community. And that's one of the driving forces why we're building St. Vincent West.
The development of St. Vincent's in the western part of our city is critically important. Just the number of jobs that will be created, that type of economic investment, the millions and millions of dollars that St. Vincent's is going to be spending to create this facility is critically important to the health and the economy of our city.
I view the role of St. Vincent far greater than just providing medical services in our community. We are really one of our economic engines in Central Arkansas. Over the last couple of years, we've made a $47 million investment in Midtown Little Rock, and I think we've seen the results of businesses around our campus growing and thriving as well. So over the next several years, we'll be making tens of millions of dollars of investment in West Little Rock. That's good for jobs, that's good for retail business, that's good for residents, that's good for housing prices. So St. Vincent can have a far greater impact than just providing health care. We can help grow Central Arkansas and grow the community of Little Rock.
I'm Chris Mortensen. You know, I've seen a lot of starting lineups. This one's impressive.
Anthony Fletcher, Georgetown University.
Fred Metters, Baylor College of Medicine.
Ali Krish, Emory University.
Kathleen Soteric, Duke University.
Lowry Barnes, Harvard.
Carlos Ramon, Tulane University.
Where do I practice?
Where do I practice? St. Vincent.
St. Vincent.
St. Vincent.
Nationally respected physicians here at St. Vincent and on your team.
St. Vincent, inspired.